Today we're talking all about heart health and how to prevent a heart attack. With me today is Krista Bobo, a cardiac coach from the Healthy Hearts for Women study that Oakwood Healthcare has. Krista, welcome.
Thank you.
Please tell us, what the heck is a cardiac coach?
Well, my role as a cardiac coach is to help people understand their personal risk factors for heart disease, the lifestyle behaviors that can impact those risk factors, and overall to help educate and encourage and motivate people to just lead a healthy lifestyle, whether it's initiating that or maintaining it.
Now, do you just work with women or do you work with women and men?
My position specifically is to work with women, but a coach in general can certainly work with anybody at any age.
Mm-hmm. Krista, you know, it seems like it's easier to lead an unhealthy lifestyle. Why is it so doggone difficult to eat right and exercise?
That's a great question, and you're right that a lot of times change is not always going to be easy, and many of us have many expectations and roles that we fill in our lives with family, friends, and work that sometimes leading a healthy lifestyle is just something that gets added at the bottom of our to-do list and, you know, is based on the time that we have left.
Well, are there some small things that anybody can do right now to lead a healthier lifestyle and to take care of our ticker?
Absolutely. Small changes can certainly add up, and it begins with having an understanding of what it is you're trying to change, and that way you can set small goals to make an impact on those healthy behaviors. And there are four main areas that I like to focus on. The first one is about healthy eating and just to eat well. If you keep a food journal, that can make a big difference towards raising your awareness of what you're doing.
What's a food journal?
It can be something as simple as just documenting what you're eating throughout the day on a normal piece of white paper. Or you can go online too and do a search, and there are many free food journals that you can do there that'll add up your calories and fat and just give you a great awareness. And from that point, you can also take a look at monitoring your portions by using a small plate, and you can make sure that you fill that up with half vegetables, and then take a look at whole grains and low-fat protein and other healthy sources that can make a difference with health and weight overall.
So food is one of the four.
Yeah.
And what are the other three?
Excuse me. The second one is to take a look at physical activity and making sure you're just making strides to get active each day. You want to take the stairs when you have a chance, you want to park farther away, and you want to try and get some structured exercise in each day, even if it's just simple arm exercises from your chair. But that structured exercise, even in small increments like 10 minutes, can make a big difference. The research is really showing that there is over 24 mental and physical health benefits towards exercise.
24? Wow.
Yes, a lot.
That makes it worthwhile.
Definitely. And the third tip is to take a look at smoking. If you're a smoker, of course, we all know you want to quit. But setting a quit date can make a big difference there. Knowing you have a goal, working towards it, and even thinking after the fact about how it's going to impact you can make a difference. And the fourth tip is something as simple as 5 minutes of relaxation every day.
I like that.
Yeah, 5 minutes is not too much, but it can make a big difference with anxiety, stress, and helping with our willpower for healthy living.
Well, give us an example. I mean, that seems like it would be easy to do, but how do you carve out 5 minutes for relaxation in a busy, busy day?
I like actually that you started out saying carve out, because you don't want to try and find time for all of these activities. You want to make the time for them. So carving out 5 minutes, whether it's when you first wake up in the morning, if that'll help to keep you motivated through the day, or if it's during your lunch, if it's just when you first get home in the evening, however it is, 5 minutes just spent focused on yourself, thinking about what you want to do, planning the rest of your day, meditating, deep breathing, those can be very beneficial.
So you got me pretty excited, because this sounds like something I can handle. Food, maybe I do a food journal, get some kind of exercise, even if it means parking at the end of the parking lot and walking in. I forgot the third already.
Third one is smoking.
Smoking. Okay, I don't smoke, so I just got to not start. And then fourth, take relaxation. Now that sounds like something I can start doing and be very excited about today. But let's talk about motivation, because if I do dive into doing those four things, how do I stay motivated?
Another great question, and I have to say that one of my favorite quotes is from Zig Ziglar, and he says along the lines of, motivation doesn't last, it's like bathing, that's why we recommend it daily. And I think it's very true that many times it is about the daily motivation. How can we encourage ourselves every day? And one tip is to take a look at not focusing on being 100% perfect, but making progress. No one's going to have a perfect day, and every step is a step in the right direction if we're doing something great for our health.
And you've been involved with Oakwood Healthcare and Ford Motor Company in a program called Healthy Hearts for Women, and that's a study. Can you tell us a little bit about that?
Sure. The Healthy Hearts for Women study began in 2005, and our overall idea is to take a look at whether personalized coaching can make a difference in reducing risk factors and risk outcomes in the development of heart disease. So the 5-year period, we've taken a look at the women who are coached compared to women who have not received a coach, and have gained a lot of insight from compliance and satisfaction. And we also did a survey, in 2009 that have showed that the active participants, the coach participants, are doing more of their health goals, and they're actually happier with their health goal progress. So we've got a lot of insight. We're hoping that we're going to have a lot more at the end of the study in 2012, and are very thankful to the women participating and to Ford for this opportunity.
So what would you quickly say to those of us who don't have a coach and we're out there fending for ourselves?
I think I would say just to never give up, that you can throw in the towel and you'll just never know how close to success you may have been. So keep striving, keep pushing towards your ideals, and making an effort, and you're going to have some success. And to also focus on what you're doing well, because that can really help you to build momentum and keep pushing forward.
Well, Krista, you have given us some actionable, easy to remember tips for heart health. Thank you so much for being here today. I want to thank you and our previous guests, Dr. Waleed Harb, Dr. Mancini, and Dr. Joffrey, for sharing their expertise today. It's all about having a healthy heart, and we want to help you do that at Oakwood Healthcare. Join us at oakwood.org.